Our Senate Finance Committee will convene for this hearing. Welcome everybody to a very important hearing. I would like to say a few words before I make my opening statement about returning here as chairman after the last time was 2007, 12 years ago when I last sat in this chair. We got a lot done. Nearly all of it was bipartisan. I'm very eager to pick up where we left off. It may be a bit harder to get bipartisan work done these days, but I hope that we can prove naysayers wrong. It's also an honor to lead this committee alongside Ranking Member Wyden. We've worked very closely over the years on things in this committee, but also lots of things outside of this committee, particularly his and I belief of encouraging wrongdoing in government to be reported through whistleblowers. And he and I have a caucus of a few members, bipartisan, called the Whistleblower Caucus. I hope to work with all of you on this committee in good faith. We will surely have disagreements with each other at times, but I hope that we use this Congress as an opportunity to improve the lives of our constituents. I know that that's what motivates everyone here, whether you're Republican or Democrat. In fact, last Congress, I introduced a bipartisan health care bill, separate bills, with each Democratic member of this committee, and I hope to do that again as chairman. So with that opening, I want to go to welcoming our witnesses and thank them for the hard work that they have to go to prepare for answering our questions. The information they will share will help inform the committee as it addresses the issue of high prescription drug prices. Millions of Americans, we worked it out. We're doing it this way. Americans woke up this morning and started the day with their dose of prescription medications, including this senator. For so many of our loved ones who have diabetes, high blood pressure, cystic fibrosis, epilepsy, and many other chronic health conditions, prescription drugs are a basic necessity of life. We need to continue to have a strong research engine to develop new treatments, but we must also have a discussion about the affordability of these drugs. Today, you will hear many numbers describing the cost of those drugs. Those numbers are impressive, but the stories I've heard from patients, doctors, pharmacists in Iowa have really gotten our attention and my attention. I've heard stories from doctors and pharmacists about skyrocketing prices of commonly used generic drugs. Usually generics are a way to keep costs reasonable. I've also heard from seniors who have seen their prescriptions increase month after month for no apparent reason. And I've heard stories about people reducing their life-saving medicines like insulin to save money. This is unacceptable, and I intend to specifically get to the bottom of the insulin price increase. But other drugs are creating problems as well. That is why tackling high prescription drug costs is one of Senator Wyden and my first priority on this committee. The reason for these high prices are complex. I plan to hold a series of hearings in order to identify and address these reasons. We will look at all aspects of the prescription drug market and make changes where necessary. So where do we start? So many of you have heard me talk about transparency and bringing accountability. So it's not very defined when you use that word transparency, but I think it starts with transparency. When it comes to drug prices, you should not need a PhD in economics to understand how much your prescription costs. I believe it starts with putting the list price of a drug on television ads as one example. I'm confident in the ability of Americans to use such information to make their best decision. Drug advertisers want to tell consumers all the benefits of a drug. They're required to tell you about the side effects. But they don't seem to be very gung-ho to share how much the drug costs. The President's blueprint to lower drug prices includes a provision to include list price on TV. The administration has proposed rule to do just that. Senator Durbin and I, in a bipartisan way, have been vocal in our support of this proposal. I look forward to the rule being finalized. Senator Wyden and I introduced the Right Rebate Act last week. When enacted, this bill will close a loophole that allowed the manufacturers of EpiPen to rip off taxpayers and consumers to as much as $1.2 billion. Speaking of transparency, I want to express my displeasure at the lack of cooperation from the pharmaceutical manufacturers very recently when they were invited here. This committee has a long history of working in a bipartisan manner to solve difficult problems for the American people. So when Senator Wyden and I invited several pharmaceutical companies to come and discuss their ideas to address high drug prices, I was extremely disappointed when only 2 companies agreed to do that. The companies that declined said that they would be very happy to have discussion with us in private, but not in public. One company said testifying would be a problem because of language barrier. I thought we all spoke English. So that is not what I mean when I talk about transparency. Senator Wyden.